Hello and welcome. Today we're diving into a lesser-known, yet significant condition, bladder endometriosis. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. So let's get started. Bladder endometriosis, like endometriosis in general, is a bit of a mystery when it comes to its exact cause. Several theories attempt to explain its occurrence. One popular theory is retrograde menstruation, where menstrual blood containing endometrial cells flows backwards through the fallopian tubes and into the pelvic cavity. These cells can then implant and grow outside the uterus, potentially reaching the bladder. Another theory suggests that endometrial cells can spread through the lymphatic system or blood vessels. A third hypothesis, coalomic metaplasia, proposes that cells within the bladder lining can transform into endometrial-like cells. There may also be a genetic predisposition, as endometriosis tends to run in families. Now, let's understand the pathophysiology. Endometrial cells, normally found lining the uterus, implant and grow outside of the uterus, in this case, on or within the bladder wall. These cells respond to hormonal changes, just like the uterine lining. During menstruation, these ectopic endometrial implants bleed, causing inflammation and irritation in the bladder. This process leads to scarring, adhesions, and potentially the formation of painful nodules. The bleeding and inflammation can disrupt normal bladder function, leading to the various symptoms we'll discuss later. The depth of the implants into the bladder wall also influences symptom severity. Information regarding the epidemiology of bladder endometriosis specifically is somewhat limited. It's considered a relatively rare form of endometriosis. However, determining the exact prevalence is challenging because many cases may go undiagnosed or misdiagnosed as other bladder conditions, such as interstitial cystitis or urinary tract infections. It is estimated that bladder involvement occurs in less than 1% of all endometriosis cases. Women of reproductive age, typically between 20 and 40 years old, are most commonly affected, as this aligns with the typical age range for endometriosis in general. The signs and symptoms of bladder endometriosis can vary greatly in severity and can sometimes be quite subtle, leading to diagnostic delays. Common symptoms include cyclic hematuria, that's blood in the urine that coincides with menstruation. Pelvic pain, bladder pain, and painful urination and dysuria are also frequently reported. Patients may also experience urinary frequency, urgency, and nocturia, which is the need to urinate frequently at night. In some cases, individuals may experience suprapubic pain or pain in the lower abdomen above the pubic bone. It's important to note that these symptoms can mimic those of other bladder conditions, making accurate diagnosis crucial. Diagnosing bladder endometriosis requires a comprehensive approach. It starts with a thorough medical history and physical examination, focusing on menstrual history and urinary symptoms. A urine analysis is performed to detect blood or other abnormalities. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, allows direct visualization of the bladder lining and can reveal suspicious lesions or nodules. Imaging studies, such as MRI or ultrasound, can help assess the extent of the disease and rule out other conditions. In some cases, a biopsy of the bladder lesion may be necessary to confirm the diagnosis of endometriosis. Laparoscopy, a minimally invasive surgical procedure, may be used for both diagnosis and treatment. While there aren't distinct types or classifications of bladder endometriosis in the same way you might see with other diseases, the condition can be categorized based on the depth and location of the endometrial implants within the bladder wall. Some women have superficial implants on the surface of the bladder, while others have deeper implants that penetrate into the muscle layer. The deeper the implants, the more severe the symptoms tend to be. Implants can also be located on different areas of the bladder, such as the dome or the trigon, which is the area near the bladder neck. The location of the implants can influence the specific symptoms experienced. Treatment for bladder endometriosis aims to relieve symptoms and improve quality of life. Treatment options range from conservative medical management to surgical intervention. Hormonal therapies, such as oral contraceptives, GnRH agonists, or progestins, can help suppress the growth of endometrial tissue and reduce symptoms. Pain relievers like NSAIDs can provide relief from pain and inflammation. When medical management is insufficient, surgery may be necessary. Surgical options include laparoscopic excision of the endometrial implants or, in rare cases, partial cystectomy, which involves removing a portion of the bladder. The specific treatment approach is tailored to the individual patient and depends on the severity of the symptoms, the extent of the disease, and the patient's preferences. Unfortunately, there is currently no known way to completely prevent endometriosis, including bladder endometriosis. However, some lifestyle modifications and medical interventions may help reduce the risk or slow the progression of the disease. Maintaining a healthy weight, engaging in regular exercise, and avoiding exposure to certain environmental toxins may be beneficial. For women at high risk of developing endometriosis, such as those with a family history of the condition, early initiation of hormonal therapy may be considered as a preventative measure. The prognosis for women with bladder endometriosis is generally good, especially with prompt diagnosis and appropriate treatment. Most women experience significant symptom relief with hormonal therapy or surgery. However, recurrence of endometriosis is possible, so long-term follow-up is important. Recent research is focusing on identifying genetic markers and biomarkers that can help predict the risk of developing endometriosis and improve diagnostic accuracy. Additionally, researchers are exploring novel therapeutic targets and developing new treatments that are more effective and have fewer side effects. The goal is to improve the lives of women affected by this challenging condition. Thanks for joining us today.